Welcome back. Subject of discussion is Propofol. Propofol is probably the most frequently used anesthetic in the anesthesia. In intensive care, as in an operating room, it is used for conscious sedation and short duration general anesthesia, in or outside the surgical room. So it is often used in anesthesiology because of rapid sequence induction, not too much adverse effects, just thrombophlebitis acute that can be prevented with titration or low dose in infusion, and make some sensibility to this drug. Physical characteristics: it is a component of 2.6 diisopropylphenol, that is an alkyl phenol with hypnotic properties. Also insoluble, it is an insoluble aqueous solution and contains some fats like soybean oil 10%, 2.25 glycerol, 1.2 lecithin, and major component is egg yolk phosphatide. This nutritional form very rich in fatty acids and lipids, other lipids. This nutritional formula support bacterial growth very well and require good sterile techniques. So to prevent this, we have to use Propofol in less than 6 hours after opening the vial. And solution also have properties of appearing milky white, slightly viscous solution. It is called in our country like got milk. Also it have a pH 7, that is acidotic pH, slightly decreased. Concentration of usual concentration is 1% of one vial of any vial, or and 1 milliliter will have 10 milligrams. Just because of a yolk lecithin component, require precaution about allergy. Here I can mention that preventing allergy from any drug we are giving premedication to the patient, and we can give steroids like dexamethasone, prednisolone, or starting with simple ones that are antihistaminics like diphenhydramine or allergostop or anything like that. So what are the pharmacokinetics and pharmacodynamics of this drug? Pharmacokinetics represent what the body do with drug. So it means if this is a tablet, it will come to the gut, it will be absorbed, it will come in bloodstream, it will go to the liver or other side for metabolism and will be excreted through urine, for example. If we are talking about Propofol, it is metabolized by liver. We are giving directly in the bloodstream. It is metabolized by liver to water-soluble form and excreted through the kidney. So coming in the blood, goes to the liver and excreted through the urine. Extrahepatic elimination through the lung, it's about 30%. Very good. And it is it's a drug that like to bind to proteins like albumin, and 97% means that drug is attached very well to the proteins. But we have to know that only a free fraction is active and have effect on receptors. Also wake up after a bolus to also cure within 8 to 10 minutes. But from my experience, it do not exceed 7 minutes of action of this drug. What about the pharmacodynamics? Mechanism of action is potentiation of chloride current mediated through the GABA A. A mean anywhere, B mean brain, receptor complex. Side effects of Propofol: so decreased cerebral blood flow. Amazing drug for patients with cranial trauma, with hydrocephalus, with anything that increase cerebral flow. Large dose required for adequate sedation. Twitching or spontaneous movements during the sedation may appear, resemble seizure activity as anticonvulsant, but no one uses as anticonvulsant if this have a other side effect like anticonvulsant for patient with risks to convulsion. It's okay. Also decrease airway reflexes and facilitates oral tracheal intubation. This is a preferred drug for rapid sequence induction of anesthesia and intubation, and have, of course, antiemetic activity. So, what is the problem with this? Propofol might produce pain on injection site, and to reduce this pain, we can use a co-administration of lidocaine, like 50 to 100 milligrams. Early in time was used 40 milligram of lidocaine, but doctors now are afraid of secondary effects of lidocaine, not only local anesthetic but also antiarrhythmic properties. But we know that antiarrhythmics are a good proarrhythmics, and you have to be cautious with this. Also, we can dilute propofol even in a health, like we are getting 5 milliliters or 10 and dissolve to 10 or 20, or using through the continuous infusion. Also, we can use a large vein that will not irritate too much this vein locally. What is the dosage of drug administration? We see that for adults dose is less than for children, because of children metabolism is very active, or hepatic metabolism. So 1 to 2.5 milligrams per kilogram. It's about induction. Later we can use for any drug in anesthesia a half of dose. But initially we are giving 1 to 2.5 milligrams per kilogram. If patient have 100 kilograms, it will be 100 milligrams of propofol, at least. For children it's much more. For antiemetic properties, post-surgically use 10 to 20 milligrams just, and it will have effect. Also, want to mention that not everyone look at this dosage and starting induction like with infusion of 40 milligrams again and again till the patient is sedated and unconscious. So thank you for watching, hope you enjoying this, and have a good day.